Good evening and welcome to Health Focus. For many years, hypertension was considered a condition that primarily affected older adults. Today, however, hospitals are seeing more young people presenting with complications such as stroke, heart failure, kidney disease, and even sudden death linked to high blood pressure. What is responsible for this worrying trend? And what can young people do to protect themselves? To help us understand this growing public health concern, we are joined by Dr. Adeyemi, a physician and a consultant cardiologist. Welcome to the program, Doctor.
Thank you for having me, Ada. It's a pleasure to be here.
You're welcome, Doctor. Many people used to think hypertension was a disease of older adults, but we're increasingly hearing of young people suffering strokes, heart failure, and kidney disease from high blood pressure. Why is this happening, Doctor?
Yes, you're right. Hypertension-related complications are becoming more common in younger people, and that's a serious concern. One major reason is that many young adults are developing hypertension earlier than previous generations.
Yes, Doctor. That's true. What is driving this earlier onset of hypertension?
Several factors. We are seeing increasing rates of obesity, physical inactivity, unhealthy diets rich in salt and processed foods, smoking, excessive alcohol consumption, substance use, and chronic stress. These factors contribute significantly to elevated blood pressure even in people in their 20s and 30s.
Oh, really? Many young people say they feel healthy and don't check their blood pressure. Is that a problem?
Absolutely. Hypertension is often called the silent killer because it may not cause symptoms for years. A young person can have a blood pressure of 180 over 110 millimeters of mercury and still feel completely normal. By the time symptoms appear, damage may already have occurred in the brain, heart, kidneys, or eyes.
Okay, Doctor. Are there cases where young people have hypertension due to other medical conditions?
Yes. Unlike older adults, secondary causes are relatively more common in younger patients. Kidney diseases, hormonal disorders, certain medications, sleep apnea, and some genetic conditions can all lead to hypertension. If a very young person develops severe hypertension, we often investigate for these causes.
Oh, okay, that's enlightening. How does poor follow-up contribute to complications?
Many young people are diagnosed but don't take treatment seriously because they feel well. Some stop medications once their blood pressure improves, while others rely on herbal remedies or misinformation from social media. Uncontrolled blood pressure continues to damage organs silently over time.
Thank you so much for the enlightenment, Doc. Now let's come to your practice. What complications are you seeing most frequently?
We are seeing strokes in people under 40, heart failure in young adults, chronic kidney disease requiring dialysis, and hypertensive eye disease causing visual impairment. These are conditions that can significantly affect productivity and quality of life.
Oh, wow. Would you say modern lifestyle has increased the risk?
Very much so. Long hours sitting at desks, lack of exercise, poor sleep habits, fast foods, energy drinks, and constant psychological stress all contribute. Technology has improved life in many ways, but it has also encouraged more sedentary lifestyles.
Yes, you are absolutely right. I can't remember when I last worked out. One final question. What message would you like young people to take away from this discussion? Because I know they are watching.
Know your blood pressure. Check it regularly, even if you feel perfectly healthy. Maintain a healthy weight, exercise regularly, reduce salt intake, avoid smoking, limit alcohol, sleep adequately, and follow medical advice if diagnosed with hypertension. The best treatment for complications of hypertension is preventing them from occurring in the first place.
The best treatment is prevention. Thank you very much, Doctor, for shedding light on this important issue. Today's discussion reminds us that hypertension is no longer a condition that affects only the elderly. It is increasingly impacting young and productive individuals, often silently and without warning. Good news is that many of the risk factors are preventable. Regular blood pressure checks, healthy lifestyle choices, early diagnosis, and adherence to treatment can make a significant difference. To everyone watching, don't wait until complications arise before taking your health seriously. Know your numbers, stay active, eat wisely, and encourage your loved ones to do the same. Thank you for joining us on Health Focus. I'm your host, Lucy. Stay informed, stay healthy, and have a wonderful evening. Goodbye.